Hi, my name is Brooke Spells. I'm in Health 698 Practicum. My project was talking about health equity focus in the community health programs at Cabarrus Health Alliance. Just a little bit about Cabarrus Health Alliance, where I completed my practicum at. It's formerly known as Cabarrus County Health Department. It is a public health authority created by the Cabarrus County Board of Commissioners, effective July 1st, 1997. Cabarrus County, Cabarrus Health Alliance is governed by a nine-member board composed of representatives of the Cabarrus County Board of Commissioners, Atrium Health, Cabarrus Physicians, the North Carolina Research Campus, Kannapolis City Schools, the Cabarrus County Dental Community, and three public members. Cabarrus Health Alliance is the second county only in North Carolina to have the Public Health Accreditation Board that they're currently in their re-accreditation year. The mission of Cabarrus Health Alliance is to improve individual and community health through service, education, and collaborative action. And their vision is to envision a thriving community where people make healthy choices in a healthy environment. All right. So, Cabarrus County, Cabarrus County Health Alliance, or Cabarrus Health Alliance, excuse me, completes a community needs assessment. The last one was done in 2020. So, the North Carolina Local Health Department Accreditation Program requires local health departments to conduct a community health assessment or community needs assessment at least every 48 months. Um, since 1997, Healthy Cabarrus has been responsible for conducting this assessment and convening a diverse group of community partners and stakeholders to collect, analyze, and interpret the county data and identify the most pressing needs among county residents. Leadership for this collaborative process is provided by the Cabarrus Health Alliance through Healthy Cabarrus. Conducting a community assessment of Health and Human Services is an ongoing process that engages diverse agency providers and individuals in identifying community assets and strengths as well as unmet needs. The Community Needs Assessment Report and its associated action plans are used to identify priority health issues and to plan interventions to build a healthier community. Based on the 2020 census data, the population of Cabarrus County has definitely grown 2,160, 453 individuals. There are more females than males. Children under 5 account for less than 1/10 of the total population. And then when we look at the breakdown of the racial distribution, there's 68.2% Caucasian, 28.1% African American, and less than 5% Asian, Native, Hawaiian, Pacific Islander. Persons of Hispanic or Latino origin has steadily increased from 10.1% to 11.9% of the population since 2016. Although Cabarrus County was ranked the ninth healthiest county within the health outcomes category in the North Carolina, according to the 2020 Robert Woods Johnson County Health Rankings. The results from the 2020 Cabarrus County Community Needs Assessment identified three areas. Issues as priority needs in the community, which was housing, behavioral health, and education, focusing on early childhood. Getting back to Cabarrus Health Alliance and the community health programs that they have created based on the community needs. You have community health programs such as adolescent health, which those are programs that they have centered around to help school-age individuals. Cooking classes for children and adults. Journey to Healthy Me is a diabetes program that focuses on type 2 diabetes. They have a kids cooking camp that they offer during the summer to involve kids in healthy eating behaviors, lifestyle medicine, living healthy with chronic disease, and worksite wellness, which is what they use for the employees. So, for my practicum, my focus was on health equity and to evaluate the minorities' access to the community health programs. So, the two programs that I decided to focus on was the Journey to a Healthier Me diabetes program, which is focused on type 2 and lifestyle medicine. So, A Journey to a Healthier Me was that they look at different sessions. They get a workbook and they actually, at these different workshops, go through these different sessions and looking at how they're eating, how they're exercising, and what they can do to maintain their blood sugar levels. The lifestyle medicine is looking at chronic diseases, but looking at, once again, how you're eating, your physical activity, are you getting enough rest, are you taking your medication as you should to improve your health. So, based around these two, of course, the two terms that come to play are the health equity, which is defined as the state in which everyone has a fair and just opportunity to attain the highest level of health, regardless of factors that affect access to care and health outcomes. And then we have social determinants of health, because that ties in to health equity, are non-medical factors that affect health outcomes. They include the conditions in which people are born, grow, work, live, and age. SDOH, also known as social determinants of health, also include the broader forces and systems that shape everyday life conditions. The evaluation of the community health programs. So, what I decided to do was to attend one of the programs one evening, and chose 10 random participants. Each program has about 15 to 20 participants, but they had to meet certain qualifications. So, of course, they had to be in the program for over a year. They had to be 18 years of age and up, and then they also had to either be African American, Hispanic, or Latina, and they had to be oh yeah, that was it. Sorry, African American, Hispanic, or Latina, in order to participate in the survey. So each program received 10 questions, one open ended. The surveys were given electronic. I did have paper copies for those who did not want to use their cell phone, and they did have a tablet there also. They were asked to complete the survey right then and there, but if they couldn't, then they were going to remind her a week later to make sure that they submit the survey to me. So, once the survey was given, it was told that it was going to remain private, confidentiality, no names will be taken, so they wouldn't have to be concerned about their information being spreaded. So, after the meeting, I collected 8 surveys, and then a week later, I only got 2. So I only received 10 total from both programs. And these are the questions and the results for those 10 participants. So the first one asked, what is your age? So it ranged from 20 all the way up to 71. Those were the different ranges. The gender, I had 7 females and 3 males. What is your race, ethnicity? African Americans, I had 8, and then 2 Hispanics. What is your highest level of education? Some high school, 3 said high school, 4 said college, 2 said bachelor degree. How are you satisfied? How are you satisfied with the quality of care provided by this program? 10 being yes, 0 being no. 10 said yes. Do you have reliable transportation to attend your doctor's appointment? 8 said yes, 2 said no. How would you rate the communication between you and your healthcare providers? All 10 said good. How has your health improved since participating in this program? 6 said yes, 4 said no. How satisfied are you with the support and resource provided by the diabetes program? And that attains to the lifestyle also. They said they were satisfied. Would you recommend this program to others? They said yes. And then I asked for any additional feedback. And they said this program has helped me become accountable for my food choices. I like the food diet, holds me accountable. I enjoy coming to the meetings. I've learned a lot about diabetes. I've even lost weight. So these were the questions that I felt were centered around health equity and then the social determinants of health that both programs had to answer. So, my takeaways from this experience, getting that data, the challenges was not getting all the 20 surveys completed. So, I just only received half the data. So, I only got half of the picture that I wanted to get, but it still was positive results. Of course, there's always room for bias. Some of the participant might have just answered the questions. They may not have understood it. They just wanted to get it over with. So you always have that chance of that bias taking place. Some difference I could have made was possibly do a focus group. So maybe do 5 at a time to come in, carve out some time during the program that I can just ask them the questions and jot out their responses and then take the data back that way. Maybe they would have felt comfortable. I would have got more response back if I would have did live focus group. Also surveying the other community health programs to compare the data to see would the responses be the same for adolescent health as it is to the diabetes program. And what I learned from this experience is that health equity is definitely being provided with the community health programs at Cabarrus Health Alliance. And the patients are seeing results and they are on the right track using those community needs assessments to build these different programs and to make sure that patients are receiving the services that they need. Thank you for listening and watching my presentation.